rolling. Get rid of that freaking sound. Alright, are we good? Am I in focus? All check. I think we're good. What's going on, guys? Welcome back to this video. Today, just wanted to talk to you guys about injury. And wanted to actually make this video for a long time, but didn't really have the time. And also, the reason why that I'm making a topic about injuries because I've gone through an injury myself. I think I had the issue at around late September last year and had to deal with it almost a year now. But I just wanted to make sure that I'm in a position to provide you good information through the experience that I had. You know, if you ever ask a gym bro who's been working out more than 2 years, you can normally relate to a topic of where you have a shoulder pain, or they'll say, yeah, I do have a shoulder pain time to time, or their hip flexors, yeah, I do get tight hips, my lower back, my knees, my elbows, all these joints, the risk of injury is always there. Now, of course, there are many ways to prevent it, but if you ever happen to have this, of course, this injury, it's a pain in the ass. So that's why I'm making this video, guys. If ever you happen to go through the shoulder pain or hip or knee or elbows, rehab, things like that, you came to the right place. For today's topic, I wanted to make it short and talk to you guys about my about the lower back. This wasn't a severe injury that I had. I did had a lower back issue back when I first started lifting, and this issue was called the anterior pelvic tilt, where I had my butt shoot through outside, like, you know, like a Donald Duck or Kim Kardashian, and I had my rib cage shooting flared up to the skies. So to break it down, guys, when it comes to the lower back, there are a few number of things that you need to know. Number one, there's always an opposing muscle group that works hand in hand to make your posture straight. The reason why we're able to stand up tall, stand up straight and walk on our feet is because our muscle stabilizes the bones. So if one muscle, let's say for example, your lower back is too tight, or let's say for my instance was my lower back was so weak, what ended up being is my upper ab took the pressure, right? So if you come to think about it, let's say you're in a research group project, and let's say if there's always the kind of guy who does not submit their work, right? And there's always the kind of guy who does the work for them. So think of it like that. There's a group project going on for us to walk around and live our lifestyle, but this guy, this lower back, is not doing the project. You know, fuck this guy, right? So what ended up being is the upper ab, the opposing muscles to the lower back to help you stay upright in the upper body, took the most load. So what ends up happening is the upper abs gets really tight and your lower back gets really loose. So when it comes to this kind of problem in your lower back, it can simply be fixed by strengthening the weak muscles and mobilizing the tight muscles. So to actually cure and treat this problem, what you need to do is strengthen the lower back muscles. So I'm gonna be telling you guys and sharing with you guys the selective exercises you could do at home or at the gym to strengthen it. And my number one choice when it comes to lower back workout, it ain't the deadlifts because it's a compound movement. The perfect workout that actually worked for me is a reverse hyperextension. What it actually is you lay flat on the ground, flat on the equipment, lay a chest against the platform, and what you're doing is you're raising your leg up, right? Allow me to put the Google image right here for you guys to understand what it is. So basically what you're doing is you're deloading the spine as your leg goes down, and you're using your lower back to bring it up. It's the same principle as the hyperextension, but the thing with the hyperextension is you can always lift your upper back with the strength of your abs. So you're not really isolating the lower back unless you really do have a great muscle to mind connection. But this hyperextension also do work, but try reverse hyper, guys. It's really gonna isolate that muscle and really strengthen the lower back. So what you'll be able to do for the issue of the tight upper abs, you just, you know, really massage it. Have your partner, you know, just push it down with your thumbs, or you can do it by yourself. Or you can do stretches such as the upward dog, which is a yoga movement and which is really great. You know, you lay down onto the floor, stretch up and really stretch that ab and breathe in. Make sure you breathe through the core. Breathing is key, guys. Breathing allows you to really connect to your body. And once you breathe out, that's actually when the muscles release, all right? So make sure when you do these stretches, breathe in and breathe out. And you can also try foam rolling your abs, All right, just lay down onto the floor and release that upper abs. Do this for about 2 months, 1 month minimum, and you'll really see the difference. You will feel tight, you'll feel strong, you'll feel great. All right, that's how I personally fixed my hip issues. Once after that was strengthened, my squats went up, and yeah, pretty much everything worked out fine. So that's it. I'll leave you guys with that. Hopefully you liked this video and helpful. Make sure to leave a like and subscribe. I'll be coming up more contents like this to resolve some issues, rehabs, mobility drills, things like that. At the same time, to prevent injury, I would really highly recommend you guys to do yoga at least once a week. We'll end the video on that. Thank you guys for watching, and I'll see you guys on the next one. Peace.